The meniscus is a shock-absorbing cartilage in the knee, sometimes called the footballer's cartilage. And we actually have two meniscus in the knee, one on the inside of the knee and one on the outside. They have several functions in the knee, one of which is to protect the gliding cartilage in the knee and act as a shock absorber so that the forces as we're walking around or playing sports or otherwise are transmitted in a better way between the thigh bone, the femur, and the leg bone, the tibia. What can sometimes happen is following an injury, the meniscus can be damaged or torn, and occasionally that can then lead to symptoms in the knee which stop people being able to function in the way that they would like to.
Originally I think it was an accident in the gym. I did feel a crack as such and my knee swelled up quite badly from it. I'd seen physios and they'd kind of suggested exercises, but it didn't feel like it was kind of doing anything. Basically I've kind of destroyed the whole of the inside and damaged the actual bones, so the cartilage was worn away on those, so they needed to kind of be repaired as such, and more of the meniscus taken away to try and alleviate some of that pain that I was experiencing.
Now sometimes we are able to repair the torn meniscus, it heals and the patient has good recovery from their symptoms. Sometimes we have to remove the torn part of the meniscus depending on the nature of how it's torn exactly. And again, they still often have a good recovery of their symptoms. Unfortunately, there's a small group of patients who have had a tear of their meniscus. They have ongoing symptoms following removal of a large portion of their meniscus.
The options were either not do anything and kind of leave it, or to do a meniscal transplant, which would involve a lot more invasive surgery. I'd already done quite a lot of research prior, kind of knowing that I was still having symptoms afterwards. I'd already looked at what other options were out there, and it was something that I was kind of expecting. So it wasn't too much of a shock for me as it probably would be for other people.
The procedure we're talking about is, the technical term is meniscal allograft transplant. So much like other transplant procedures which we perform here at the Jubilee, we are using a donor's tissue to replace the torn and removed meniscus in somebody else's knee. Unlike organ donations such as heart, kidneys or liver, the tissue types don't need to be matched, but what needs to be matched is the size of the meniscus. Everybody's knee is slightly different inside, so you need to make sure that when you put the new meniscus inside somebody else's knee that it fits in the space appropriately and can be held in place with stitches. So the first thing you need to do is organise x-rays of the potential candidate for the surgery so that those can be sized so that the companies that provide the tissue can match it for size. There's also very strict governance around identifying the tissue and making sure that the donor is safe from an infective point of view. So they screen for things like hepatitis and HIV, as well as making sure the tissue itself is sterile and not contaminated. The tissue is fresh frozen tissue, which means it has quite a long shelf life as well. So we're not in that kind of rush where you may have to operate in the middle of the night. This is something we can do in a planned, scheduled way.
I could already feel a difference kind of 6 weeks afterwards in terms of how it felt actually putting weight through it. I could feel like something was inside my knee compared to before when I didn't have any meniscus in there. So that's something I noticed kind of straight away after a week of weight bearing.
What we know is that 70 to 80% of people who have a meniscal transplant see an improvement in their symptoms and sort of a survival of that transplant up to 10 years following the surgery. So while this is a new procedure for Scotland, and we understand we're the first centre in Scotland to do this in collaboration with one of my colleagues at the Queen Elizabeth, it's performed quite regularly around the world in different centres and isn't really considered an experimental procedure anymore. We've gone through a very careful process in terms of setting up the service. We've done it in collaboration with a consultant in GGNC so that the patient has two consultants operating. We've gone through a training process, surgical visits, and gone through our clinical governance processes to make it safe for the patients. It's not a common procedure, so there are only a few patients that really fit the criteria. If you look at other studies, it suggests that per year you're looking at 1 per million population. So in Scotland, maybe 5 or 6 patients per year that would need this procedure.